Hi, my name's Grace, and I'll be presenting on paternal kangaroo care. So, the reason I wanted to do research on neonates is because I really enjoyed my women's health clinical at St. Thomas Midtown. On the labor and delivery floor, I got to watch my first live birth with a young mother and father, and it was just so joyous. And I really wanted to be a part of this part of healthcare. So, why is this topic even important to look into? One day while we were in our women's health and pediatrics course, the instructor said that this is the fatherless generation. And that really stuck out to me. So, I looked into that, and the Fatherless Generation Foundation said that 1 in 3 children are living without their fathers in the home. So I thought that maybe if I could look at the impact that fathers have on their child, specifically during kangaroo care, that I could encourage fathers to be active in their child's life. If they could see what impact they had, then they would be motivated to be involved in their child's care and to continue that throughout their life. So some statistics from the Fatherless Generation Foundation is that children are 20 times more likely to have behavior disorders without the father in the home. They're 5 times more likely to commit suicide. They're 32 times more likely to run away. They're 10 times more likely to abuse chemical substances. And they're 20 times more likely to end up in prison. So obviously, these are some huge statistics, and I think that that's why it's important to look at the father's impact, especially during kangaroo care in that early neonate stage. So my research question was, what are the effects of kangaroo care performed by the father on a preterm infant in respiratory distress compared to the effects of the mother, an unknown nurse, and a known nurse? So my very first draft of the question are, what are the benefits of delayed cord cutting waiting 2 minutes or greater after a vaginal delivery of a full-term infant? However, this is widely researched and widely accepted, and so I switched gears to kangaroo care and with a unique perspective on paternal kangaroo care to get a research that is not as well looked into or defined. So on my second draft of the question, I started to look at kangaroo care specifically in fathers. And my question was positive effects, appropriate adjustment of respiratory rate in kangaroo care with fathers in respiratory problems in preterm infants. This question needed a lot of work. When I read it back to myself right now, it's not even clear what I'm asking. But I wanted to explore whether the father had the ability to stabilize or calm an infant with respiratory distress. But there was a lot of unknowns and outside variables that could affect this, and this question just wasn't well defined. And I only looked at positive effects, whereas your research should explore both the positive and the negative effects. And it lacked control groups. In my mind, I thought I would have 2 groups. A group of infants that did receive kangaroo care from their father, and a group of infants who received no kangaroo care at all. I would record respiratory rate. I would record it for 5 minutes at each minute mark. So at 1 minute, at 2 minutes, at 3 minutes, at 4 minutes, and at 5 minutes. I would have one group that didn't receive kangaroo care taking those recordings, and then a second group who got kangaroo care from their father. And again, I would record the respiratory rate before the kangaroo care started, and then for 5 minutes once the kangaroo care started. 1 minute, 2 minute, and so on. I would also look at their workup breathing and use of accessory muscles. The father would do skin to skin. The baby would only wear a diaper, and I would record the respiratory rate. And that's where I was at for the second draft. However, like I said, a lot of unknowns and a lot of outside variables that could affect this research. So my third draft was, what is the difference in response of respiratory rate in preterm infants with respiratory disorders when comparing infants who did receive kangaroo care from their father versus preterm infants who did not receive kangaroo care from their father. I was attempting to make this research more specific and qualifiable, and I thought that I had added some more guidelines to narrow down my research topic. I also made it comparative in style, looking at kangaroo care in receiving kangaroo care and not receiving kangaroo care. But again, I'm lacking control groups to compare the father to, and there's also still a lot of unknown variables. There's an unclear purpose in this question as well. So my fourth draft, what is the difference in response of respiratory rate when receiving kangaroo care from the father in preterm infants with respiratory disorders who are currently experiencing respiratory distress with increased respiratory rates when comparing infants who did receive kangaroo care from their fathers versus preterm infants who did not receive kangaroo care from their father? This is a mouthful. It was hard to understand because it was so lengthy what I was really looking for. Again, I'm still lacking other control groups, and there's still so many unknowns that could affect my research. So my fifth draft, what is the difference in respiratory rate of preterm infants with respiratory distress during kangaroo care from the father compared to preterm infants who did not receive kangaroo care from their father? It seems like I wasn't able to kind of get this question moving at this point. I'm facing the same struggles, lack of control group, and still all these outside factors that could potentially skew and affect my research. So in my sixth draft, I arrived at my final research question. What are the effects of kangaroo care performed by the father on a preterm infant in respiratory distress compared to the effects of the mother, unknown nurse, and known nurse? Here my research switched from quantitative, where I'm just measuring the respiratory rate, to mixed method observational study. I added control groups so I was able to compare, and I better defined my research question and eliminated unwanted influences and variables. I would compare these results through observation and compare them to kangaroo care by the mother, primary known nurse, and unknown nurse. I would exclude infants with unstable hemodynamics, congenital anomalies, recent surgeries, use of oxygenation devices, and use of steroids. The infants would be between 32 and 35 weeks gestation and between 4 and 5 weeks old. I would include infants weighing 1,700 to 2,500 grams, and the included infants would have an oxygen saturation that's been stable above 92% the 2 weeks prior to the study. However, they would have an increased respiratory rate of 62 to 70. The infants would be in the fetal position with legs and arms flexed and head turned to the side. They'd be placed on the chest of the person initiating kangaroo care with only a diaper and a hat and a light blanket over them. The infants wouldn't be restrained, so they'd be free to move, and kangaroo care would start 1 hour after feeding the infant. The participants would be asked to refrain from eating, drinking anything except water, and odors or perfume for 1 hour prior to the study. The study would take place in a private room with a curtain pulled around them to isolate the participant and infant. The temperature would be maintained between 22 and 26 degrees Celsius and a relative humidity of 40 to 60%. The researcher would observe the kangaroo care, recording respiratory rate, cooing, and demeanor of the infant every 5 minutes for 1 hour. It would take place for 6 consecutive days, 2 days for everyone to initiate kangaroo care. And this is how I ended my research question. Thank you guys so much.